you all for attending. My name is Harrison Pierce. I am the Chair of the Health and Human Services Commission. Before we get into our agenda, I would like to introduce Peter Campbell. Peter is our newest member of the commission. Thank you so much for joining, Peter, and agreeing to serve. If you just give us a little background of yourself, education, family, business, and anything else you think is cogent. Thank you.
Great, Harrison, and nice to see everybody this morning. So quick background on me. I grew up in Storrs, Connecticut boy, where my mom still lives, bless her soul. And then kind of spent most of my time in New England, went to college, was a poli-sci major in New England, and business school also in New England. And then kind of had landed after being in New York a bit and overseas in New Canaan about 16 years ago with my wife, Sibyl, and who is an EMT in town, and two daughters, 15 and 17, both in the high school, May and Pia. My day job is I founded a private equity firm, very mission oriented, focused only on education and human development, which allows us to look at things in K-12, higher ed, lifelong learning, corporate training, behavioral issues, as well as kind of everything to do with HR, including future of work. It's very exciting and I think important work, and very, very gratifying. And we're based in Stamford. I've also been trying to get involved in the community. I've been involved with Norwalk Hospital for a long time, and I'm on the board there and on the community health committee, where I was able to spend time with Jen Eilson, and she and I vigorously represented New Canaan at all meetings, and that was quite gratifying. I'm also involved in the behavioral health committee at the New Canaan Foundation, which is a pretty amazing group and organization driving a lot of, I think, important work. And also involved in the Governor's Workforce Council. We do a lot, my firm, on the future of work, and trying to stay involved in the economic recovery and development of Connecticut, which I'm pretty passionate about. One thing I've learned through all these experiences is that great solutions tend to run through people and community always. And I couldn't be happier to be joining this very people and community oriented commission, and really honored to kind of work with this fantastic staff and all of these great commissioners who I'm really looking forward to getting to know more and learning from. So thank you for, I guess, allowing me to be working with you. I'm really excited to serve, and can't wait to get underway. I think there's a lot we can do together.
Thank you, Peter. Agreed. Okay, to the agenda, the first item is the approval of minutes. These are the April 7th minutes, not the March 3rd. So that's the first correction. Are there any questions or corrections to the minutes?
I make a motion.
If not, may I
approve?
May I have a motion to approve? Thank you, Russ. Second, Tom. All in favor?
Aye.
Aye. Thank you. And thank you again, Alyssa. Reports, Health Department.
Okay, I emailed you all the report at Russ's suggestion yesterday. So that will help me from having to say every stat for first, second, and third dose. So please refer to the stats that I sent you. But overview.
Thank you, Jen Eilson, the Director of Health.
Oh yeah, Jen Eilson, Director of Health. So anyway, so percent of total population fully vaccinated, which is a fully vaccinated definition, is still only the 2 doses by CDC. So it's 88.58% for New Canaan. Percent total population with the booster, meaning third dose. They're not yet doing the fourth dose calculations. It's 54.24%. So we still have a way to go with boosters. Total doses administered to date by the health department are 23,869. We continue to do clinics every week. We have one today at Irwin Park. Today we have 91 signed up. And to put it in perspective, Westport only had 35. So we are actually trending a lot higher than the area towns. I think part of that is communication wise. We are hearing from people that, you know, they try to go to some pharmacies and stuff and they don't have the vaccine or say they don't have appointments for whatever reason. So they come to us. We are also still doing mobile clinics at Waveney and Silver Hill. We have more signed up for Silver Hill in the upcoming weeks. We're still doing homebound. We did 23 homebound vaccinations in April, 2 of which we ended up doing Wilton residents because their health director asked us because they don't have a vaccine program. And it was right over the line, so whatever. Manufacturer updates. Pfizer has submitted for a booster for the 5 to 11-year-olds. We don't know when that's going to be approved or if it's going to be approved. But if it is, I've already begun talking to the schools. So we will offer it if it does get approved for the 5 to 11-year-olds. Moderna has submitted to FDA for the 0 to 6-year-olds. That has a meeting scheduled with the FDA in June to begin discussing that and go over the data. So the hopes of originally March are now looking more like possibly July to start that age group. So we'll see. Testing, we've done 1,591 rapid tests to date. Total of 90 were done in April. 8 out of the 90 were positive. PCR testing, we're still doing Monday, Wednesday, Friday with Progressive Lab. We did 1,201 tests since January, 386 in April. And to put it in perspective of how things are changing, yesterday we had 38 tested and 8 of them were positive, which is a very high positivity rate. The state health department has asked me to be the pilot department to test a new test reporting database for them called Casetivity. So we'll be the only health department in the state using this database to report the test results. So I'll provide feedback on what to change and what's new. Yet again, another new database because, you know, we don't have enough going on. Let's have another new database. Cases are clearly on the rise. We had 53 all total of last week. And so far this week, I have 98. That doesn't include the schools reporting yet today. Janet usually reports to me by noon. So we'll be about double what we had last week, which really isn't surprising after school break, Easter, you know, people are beginning to do things again. The main importance of everything to keep people in perspective is the hospitalizations, the deaths, those are still remaining steady. Dr. Reed told me as of yesterday, there was only 9 in Stanford Hospital with COVID. So that's important. On our DPH call yesterday, Dr. Carter said that the state health department is referring to this as a swell, not a wave, because with the wave, we had the spike in hospitalizations. This, we're seeing the rapid increase in cases, but very low incline in the hospitalization rates, which is what's the most important, is severity of disease. CDC still has us listed as green because of hospitalizations and deaths being low. And CDC also uses wastewater data. So they get a more accurate picture of what the true positivity rate is. Because we all know with home testing and other things, we don't really know the exact number, but wastewater data kind of captures all that. And obviously hospitalization data captures the severity. Moving along.
And can I interrupt you for a second? What's wastewater data? I should probably know, but.
So like your sewer treatment plant.
Oh,
So
actually, okay.
in Connecticut, there's only 3 test sites. There's one in New Haven, Fairfield County near Stamford, Greenwich area, one in New Haven, and then one near the Danbury area. And what's interesting with that is it doesn't only just collect the sewer data, because obviously sewer goes in the treatment plant, but the septic, when it's pumped from the septic pumper, goes and gets dumped in your treatment plant. So you can still kind of collect the data and get a better picture of what's going on. So,
Jen, the people coming in for tests, and I guess the positives that you've had recently, are they coming in because they're sick or because they think they might have been exposed? And in other words, are you seeing people that are actually?
It's a little bit of everything. So about a third of it is still travel, because a lot of going out of the country requires testing. A third of it is they were exposed, so they just want to, a couple of days later, kind of do the right thing. And then a third of them are symptomatic. Nothing like severe that we've seen per se, but more like the cold, like sore throat, the severe headache, those kind of things. But with allergy season and other things, it gets kind of hard for people to really know. So they just like to rule things out too.
Yeah.
While we're still on COVID, I have two questions, Jen. One,
Yes.
I had my second booster shot on Moderna and was down for 2 days. And I had my first booster shot, I was down for 3. So that's a good trend line.
And better.
If we're going to be giving it to children in a month or so, whether we should be preparing the parents for some kind of a your kid's going to be not feeling very well for 24 hours or whatever. Is there any guidance been given to you from the state?
No, because like usually with the second dose, is when you get the most effects with the younger demographic. So we went through it before. So we don't really know. Like for me, I had the first booster because obviously I'm not 50 years old, so I can't get the fourth yet. But I had no effects on the booster shot. The first two, I thought I was dying.
Yeah.
I mean, it was bad. Number 1 and number 2. So everyone's kind of different in how they react to the booster.
If this is a half dose or half whatever they did to make it available for children, again, if Johnny is acting strange, the parent ought to be prepared for.
Well, yeah, we give them a handout when they come to the clinics of side effects. Like even on there, we have myocarditis, even though it's very rare. We want the parents to be aware of what to look for and that it is a possibility.
Right. Okay. The other question was on your positivity cases by week graph. I mean, that's pretty dramatic. And I'm wondering if indeed the new normal is going to be between 40 and 80 a week.
Yeah, that's what I'm been guessing with Brian and Janet. We kind of have now kind of accepted this is kind of, the way it is. And we always keep each other in perspective of, yeah, the cases are up, but, hospitalization's not down. Keep going, because we don't want to get back into quarantining classrooms. We don't want to get back into, any of that stuff. We pluck out the positive and keep going.
But just because you're not going to the hospital does not mean you're not going to be wrecked in some way or other if you get it. And I think too many people are getting too lackadaisical about.
The more the concern is staffing, not necessarily the children, because there's already been a handful of schools closed in Northern Connecticut because of staffing. So it's not so much the kids all testing positive. It's more of making sure staffing, just like in hospitals, in Waveney, you need the staff. You don't want them testing positive.
All right. Well, and this thing, I don't know whether that's a one of a kind that he's closing because of the trend line and COVID. Is there any other Chamber of Commerce members, as it were, following the Zoombach model? Or
I don't know why Zoombox called. They didn't tell us they were closing, so I can't comment on what exactly happened. We didn't close them, just to be clear. Okay. But I mean, we had this issue in December when Omicron, really spiked. A few of the retailers, in town had to close simply because of staffing. The staffing tested positive. Let's face it, retail and restaurants are short staffed, just like public health and the healthcare industry is. I don't know where the workforce went, but there isn't, this magical staff that they can pull in. So usually these smaller places, when COVID hits, it's a staffing issue of why they have to close.
Jen, first, thank you and Kevin for keeping weekly COVID still on the front line and communicating to everybody. I thought that was extraordinarily important. And also thank you for continually boosting our senior community, especially our Waveney residents. And thankfully, we haven't had a positive case in a really long time. To Jim's point, we haven't had secondary complications either. We've been following the mix match methodology alternating between Moderna and Pfizer since the beginning. And that seems to have worked extraordinarily well. But we're getting to a point in time with the Omicron variants that are coming out, and now we're at B4 and B5, and it just continues, that we're getting close to being contagious as the measles are. And I think Jen is correct. I don't think we're going to see spikes. I just think we're going to reach to a certain level, and that's going to maintain unless we can get our booster levels up to a fully vaccinated level. And I think Jen is right in saying that needs to be above 50% for our communities. But I applaud Jen, you, and your tireless efforts since the beginning, and keeping everybody, keeping this news at the page every week, you and Kevin, and also for all you're doing to try to keep our booster levels up. I think more and more communicating what fully vaccinated means, I think is critical to our community. And I think you guys are doing a great job. So I just, on behalf of myself and hopefully all of us here, thank you for that.
Thank you.
Barb, one interesting thing about the wastewater, sewer water, whatever, is it has some prognostic value too, like happened in New York City. The numbers were up before the incidence of the illness amongst the people in the hospitalization was up. The Norwalk Hospital there, as of last week, they had 4 COVID patients, no one in the ICU. So what's been mentioned is the increased contagiousness but decreased severity seems to be holding. Janet Reed, the nursing supervisor for the public schools, gives me an update every week and on Friday. But she called me on Monday to say there were 44 positives and 11 with students and 11 staff. So the numbers are certainly going in that direction. She also sent me the email, which has been going around, and Alicia and Alyssa, you're probably aware of this, maybe Jen too, of the don't test, don't tell, quote unquote. So the numbers that we have are not that accurate. People, parents, mothers are avoiding the testing. They don't want their kids missing a week of school and or the athletic or other extracurricular activities. So this has been going on for a while, but the proof is in the print, and c'est la vie.
Yes. So Alicia Meyer, Commissioner, there is a Facebook group, Mass Choice New Canaan, that posted in their social media not to test and not to tell the schools, because the schools do have protocol for when your kids have COVID, that they need to stay out for a certain number of days and then mask upon return for a certain number of days. And there are parents actively advocating for not testing and or testing, but not telling the school, so that their kids don't stay home for the full quarantine and don't mask upon return.
Thank you.
For one ray of hope here is I follow the COVID data around the world, and the UK is the best country for tracking data. And they were high for many months. They are way down the last month. And so I would, based on that, I would foresee our fairly high rates right now dropping. I don't know when, but at some point, not too far out in the future, I would expect they'll come down. Now, maybe there'll be a B6 and a B7.
Yeah,
but,
I mean, but like we've said time and time again, we're on year 3 of this. This ebbs and flows, but each time, as long as we can keep the hospitalizations down, because in January, the hospitalizations, that was only a couple months ago, we're over 2,100, to put it in perspective. And we're at 245 as of yesterday with the governor's report.
Right.
So that's, the advocating of the test to treat, all the vaccines. There are the tools out there that people just utilize them. So,
Jen, I have two questions related to boostering, particularly because anecdotally, I know a lot of people who had it right now, including my own family, had it recently. And everyone feels like they're at the waning protection of their November, December boosters that they got, or a lot of the kids who got it November, December. What is the timeline for for boostering the under 50 population? And then second question, what is the recommendation for boostering for someone who has had a recent COVID case?
they have no timeline at all for the under 50 yet. So for the fourth dose, the second booster, if that's what you mean. And I'm sorry, what was the other question? I'm losing my mind.
Oh, the other one was
you've had
people who have
COVID.
recently had
If you've had COVID.
recently. Yeah.
They tell you to wait the 90 days, but you don't technically have to, but you're better off just waiting the 90 days.
Yeah, there's no absolute rule on that, and everyone is treating it differently. They're open to their own interpretation. Some physicians will tell you to, as soon as you're healthy, go get your booster. And others will say, wait the 30 to 60 to 90 days. So.
Okay.
Alicia, the only thing I can say is for what we're doing as the largest employer in the town, over 50, it is every 5 months. Under 50, we're doing every 6 months. We are monitoring those levels, and that seems to be working extremely well for us. But that's, again, I guess we are, kind of a test case since we've been in the middle of the healthcare since the beginning. But that's what we've been doing.
Thank you. That's really helpful to know because, for the under 50 crowd, we all are at that 5-6 month point since our last booster. And for, the 12 and under, or the 5 to 12 that were vaccinated.
The 5 to 11, I think it will be, probably by early June, because that is submitted. They did submit the data for that. They just gotta agree to it and what the dosage will be. Is it gonna, because it was a small dose to begin with. So I think that is definitely around the corner. But, to Russ's point about Waveney, when anyone starts, saying vaccines don't work and blah, 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 I always point out to the nursing home data. Look at the nursing homes and look at the original deaths in the beginning and positivity, and look what now, how it is. Vaccines work, and they work when you get boosted and your staff gets, boosted and everything else. And you do all the infection control measures that, like Russ and his team do with the testing and the masks and all those mitigation measures, they're layers. And when you begin to move the layers, that's when problems occur. That's why it's, the nursing homes have been a great, case study of really how to make it work. Moving along to environmental health, our pool licensing has been sent out. We have to inspect and relicense all the public pools, which includes the condo pools, the country club, YMCA, yada, yada, by Memorial Day. Salon relicensing will be sent out in May. Those all have to be inspected and relicensed by June 30th. The septic and garbage trucks and relicensing was mailed out. Those dates are set for June 15th and the 22nd at the transfer station. The garbage trucks and septic trucks all come on those days and we inspect them. Building permits and septic inspections and all that still remains high. This is our busy time of year for that anyway. Sep Grant update. We did the tabletop exercise last Friday at Sacred Heart University on anthrax, and actually our fire chief, Albie, was a trainer, so it was great. There's about 100 participants from local health, EMS, police, and fire. It's one of the deliverables for our Sep Grant is to hold X number of drills, X number of tabletops, and attend X number of meetings. So the next training for public health emergency preparedness is radiation emergencies for first responders and local health, and that's on May 19th. Other general updates, as I discussed previously, House Bill 5045, an act for lead poisoning, reducing lead poisoning, has been passed unanimously from the House of Representatives. It also passed the Senate, and it's awaiting the governor's signature. It's the governor's bill, so he will be signing that. And that's the bill about lowering the elevated blood lead levels in children under 6. So when they go to the pediatrician's appointments, they get, tested for their blood lead levels. Before, you used to be considered, poisoned at, 20 and above for full-blown investigation, 5 to 10 for, just normal education, 10 to 20 risk assessment. The goal of this bill is to get everything down to 3.5 and 5. So that's obviously going to increase but not only cases and inspections, but also needing to retest with your pediatrician. And speaking of lead, I had my recertification last week. It's required by general statute every year. We have to retake a one-day course and retake the test every. So Chris goes next week. Community health improvement plan with Nuvance. Peter alluded before, we're on a community health group with Nuvance, formerly Norwalk Hospital. And part of a DPH mandate is to create a community health improvement plan. And in order to create the community health improvement plan, you have to do the community health needs assessment, which is a survey that's sent out by June 30th. We got to collect the data. So sometime in the next month, I'll be sending it out, probably through Everbridge, through the residents, because obviously our needs in New Canaan are not going to be the same needs of Norwalk. So, it's important that people do respond to the survey because it helps us know what the number one, things are in town. We can guess that, mental health and these other things are the number one needs, but it helps to have the data to, support that.
Stanford has a fairly detailed community survey that I think is probably on top of the CHIPS that takes a look by actual community that I think is less than 2 years old and maybe less than that. But when we began looking at, I applaud Russ's idea for beginning to look at some kind of framing of what's healthy and et cetera. CHIPS is not going to be it, as I recall from seeing it before. But when we hold CHIPS up with the Stanford thing and the Nuvance, et cetera, we will be able to see a numerical version of what's healthy, I think. Just throw that in.
Well, and it's more of what people, the importance to them, because then it runs the gamut from heart disease to cancer to mental health to substance abuse, and to food insecurity, housing issues. So like the issues in Norwalk are not going to be the issues in New Canaan. That's why me and Peter have had to fight for so many years being on that community board to get New Canaan into the forefront, that our needs are not the same.
What you see is alcoholism running rampant in Darien and New Canaan.
Yeah, well, and lastly, the ELC2 grant, which is gonna fund 3 of my nurses, has to be revised. The Attorney General's office is kicking them all back because of the changes to contact tracing with the CDC guidelines. So I was on the phone with person from the State Health Department for an hour yesterday about it. So revising the language and resending it to the Attorney General's office. We'll still get the money. It just changes what the work plan is and what they can do, because they're not going to be doing contact tracing at all. So that's it. And if anyone cares about flu, the latest data on flu was to season. We've had, there's been 7 deaths flu related in Connecticut, 0 pediatric flu deaths. Influenza associated hospitalizations, according to DPH data, is to date, there's been 265 total. So.
That sounds very light. Is that right, Jen? Is that a light amount of flu or is that normal?
It's pretty low. Not as low as last year and the year before, because the last 2 years was really low because you're masked up and you're not, you know.
Okay.
But
Thank you.
One of the few good things about COVID.
yeah, there'll be another problem, trust me.
Kim, do you have a question?
Yes, thank you, Bethany. Hi, everyone. My name is Kimberly Norton. I'm on town council and I'm the co-chair to Health and Human Services. I just had a question for Jen about the Community Health Improvement Plan Survey. I was wondering if it's like a standardized format, or you will be making it
Yeah,
up.
it's created by Nuvance. So all
Okay.
so in our group that Peter and I are on, it's me, the Director of Health for New Canaan, from Norwalk, the Director of Health for Westport Weston, and then we have AmeriCares, you know, Positive Directions, the Hub, all these other agencies, nonprofits are included as well. We all send out the exact same survey, so it's comparable data.
Okay, thank you. I mean, I wanted to make everyone aware that the town council is going to be taking up the issue of creating an ordinance for gas-powered leaf blowers. And some of you may have received letters from residents that are concerned about the health effects. So part of their presentation is coming out of the Conservation Commission, is focused on environmental health and how it's affected by gas-powered leaf blowers. So I didn't know if that was something that could be added to the survey, or perhaps there's a.
No, this is
No.
a standard. This has nothing to do with something like that.
Okay, because that's kind of an issue that's been coming up with residents. So I just wanted to throw that out there. Maybe we can discuss that at another time in this meeting. Thank you.
Thank you, Jen. Next item, Human Services.
Hi, everybody. Bethany Zaro, Director of Human Services. I'm going to move quickly along with the report because then I'm going to give a presentation on the gist of Human Services and what we're doing in the departmental level. So food pantry, blood pressure clinics continue with the population. Employee programs, we have this going on right now. We have a blood drive with the fire department today. Enza is up at Lapham Community Center doing that. We have a mental health training at the end of May, and this is for employees of the town that have direct communication with the public. It's limited to 30 spaces, so we're going around. Enza is getting the list of those people. It's being able to be more aware of if someone is experiencing a mental health crisis and how to navigate through that in a safe manner for both the possible mental health client and the employees, keeping the employee environment safe for everybody. And then we have continued our OSHA training for the rec department and in DPW. We are having classes working with the directors there, and Aggie at Lapham Center once again is very nice in offering the space. So community collaboration, Laurel House, which is a behavioral health organization and on-site living situation where we've teamed up with them, and they're going to start having a caseworker come to Millport Apartments in Canaan Parish. It'll be at Millport while Canaan Parish is under construction, but we're going to start trying to offer help and assessments, things like that, for those people that might not be able to get to Laurel House, which is located in Stamford. And they have unbelievable groups in terms of just seeing where your job strengths are, identifying if you do have anxiety and other mental health, behavioral health issues. And we're working with the NCL, National Charity League. They're always very kind in doing projects for the seniors. So we have projects going for Schoolhouse and Lapham, and they will be doing those May and June. The next thing we have is the New Canaan Behavioral Health Alliance. This is a group of nonprofit and profit organizations in town, behavioral health entities, as well as departments and like Lapham Center, Staying Put, New Canaan, things like that, putting them together resources as well as organizations learning about what resources are available. So we have about 40 people on the list. It's going to be June 22nd at 11 a.m. New Canaan Community Foundation, felt through their assessment purposes for the past couple of years, realized, that we need to bridge a gap between resources, immediate resources, and the family or the individual needing help at a faster pace than really what is out there right now when you just start navigating a behavioral health issue. So we're excited about that. And that will be our first launch of the meeting. And it's very much like the coalition used to be 2 or 3 years ago, which stopped during COVID. And this was a monthly get together of area resources as well as residents in the community. We're going to keep it more professional in terms of entities, behavioral health, and public entities where people do congregate, so that there is a sense of networking and working together. So that is going to be very exciting, and hopefully filling a disparity that we do see in the behavioral health assessments. All right, the next thing is Jackie is not in the office this week. I'm going to give her a rundown of her April work that she did, and it's very highly concentrated in referrals, domestic violence reports. There were 5 in the month of April, police referrals. There were referrals through churches. Some old families, previous families have moved back into town. She's added the YMCA childcare as part of her social service consultant preschool list. And she is working with, there's a new social worker at the public school, and she is bilingual, and they've already teamed up with mutual families, keeping an eye out for them. So it's very much highly referral concentrated right now with domestic violence and people seeking help, which is great. They know where to come. So that is just a quick update for her. The next thing I want to do is I'm going to give you a presentation on what Human Services does and how they're following the mission statement. So I am going to share my screen with you. Can everybody see that?
Yes.
Yep.
Okay. All right. So what we do, this is the New Canaan mission statement for Human Services. And it's really divided into 2 parts, but you can read it and see that it's about functioning optimally in our community through developing programs and activities that address developmental needs for people of all ages, and then also helping residents obtain the appropriate social resources and services.
Bethany, I just want to mention that you present this to the Selectmen, Town Council, Board of Finance, which she's already done, and we deferred this until now for all of our sakes, but also for our newcomers, Barb and Peter.
Yes, and this is what I've tweaked it for our purposes today, so it's a little shorter. But I will go through this, and just know that this mission statement, it's been in New Canaan for years. And this is what we follow. Okay, so the Human Services Department, we have Human Services, and with this mission statement, it's divided into individual assistance and community outreach and education. And just understand this is all a fluid work in progress every day. So the individual assistance, when someone comes in, there are state and federal programs, human service programs, agency grants that we use in order to help with listening to their story and seeing what they qualify for and helping them get the needs and resources available within their reach. And then the community outreach and education, that's a constant partnering with so many entities in the area, and I'll go through that in another slide. So to give you some information, total population, this is the 2021 data. 20,000, about 6,800 households. Our human services clientele is about 1,000 of those people, which is about, of the residents, which is 460 households, we estimate. And this is when people come in and they use our programs, our agencies, that we're providing support and helping them, get the state and federal programs necessary or what they qualify for, filling out applications and leading them in a direction of assistance. Broken down with these households, we can see that age group, the total population, children, 7,000, and we serve about 170 of them in this assistance being provided. This does not include the public at large who attend the educational programs that we co-sponsor with other entities and school programs, but we help organize these, and it does not include residents that are contacting us with specific questions and referrals, but they don't necessarily need our programs, and so it's a very light level. But these are solid, this is our clientele that we work with throughout the year, and they have to every year update their financial assessment to see that they qualify and that the taxpayers' money, the resources they're getting from the town, financial assistance is appropriate. So the state and federal programs that we work with and work with Department of Social Services, the Agency on Aging, which I'm an advisor for. That's the Agency on Aging. We meet monthly and discuss disparities and things that are going on in our catchment area of southwestern Connecticut. There are 5 catchment areas in the state of Connecticut, and we are the Southwestern Connecticut Agency on Aging. So Connecticut Home Care Program for the Elderly is a wonderful resource for those that have run out of money, but they need assistance, and they still are able to stay at home, but we have assistance come to them. We have the Husky Medicaid Health Program, the food stamps, which is called SNAP, the Medicare Savings Program, energy assistance, and the renter's rebate, which is in progress right now. And Marcy will give you an update when she gives her report. So these are the programs that state and federally are offered to Connecticut residents, and we are obligated and always try to see if they qualify. So New Canaan, people served by the program. This is state social services. You can get this data anytime, any of these metrics. CHIP is the CADAP, that is an AIDS program. And anything less than 5 people, they do not show any numbers just because of confidentiality. But we do have clients that are positive that we work with here that have AIDS, but it's not included here, but there are less than 5, but some of those are our clients. Yes.
Bethany, can you take questions now?
Sure.
I note that the Medicaid line has gone up a lot in the last 8 years. Do you have any sense why?
Combination of qualifications, who qualifies, they change their qualification criteria. More people do apply because more people are qualifying because they've changed their qualification standards. Yeah. So it's a combination as the economic environment as well as the qualifications.
Because that's a high, that means about over 7% of our population is on Medicaid. And I can only imagine what it would be in a poor city like Bridgeport.
Correct. Correct. And this is, they fill out an application online. They find out really quite immediately whether they qualify.
Thanks. Yes.
Yeah, but definitely there's been an uptick. The CHIP, that's the Children's Health Insurance Program. You can see numbers there. Medicare Savings Program, that is, you don't have to, you might not qualify for Medicaid, but you might qualify for the Medicare Savings Program. It's a higher income level or a higher federal poverty line level. But if you do qualify, you can be on Medicare and Medicare Savings Program. It's not just associated with Medicaid. The Medicaid saga is state administered general assistance. And it is like temporary family assistance. It's cash. You're getting cash. It does not include SNAP, food stamps. Most people that have food stamps are probably on, they might qualify for the extra cash as well for daily living expenses. And then we have the SNAP, social work services, state supplement. Once again, state saga funeral, state supplement, and TFA. These are all cash money related beyond SNAP, and we have to refer them on to Department of Social Services, where there is another caseworker or person that takes over from our point of view. Just know that Marcy and I are both choices counselors, so we are aware.
Yeah.
Yes.
Question, the monies for these programs, am I correct that they generally come out of state coffers, not town coffers? Is that right?
Nothing comes out of town coffers here.
Okay, but this is probably a fair amount of money just for our supposedly wealthy town. It's impressive, but
Yeah, no, there are people that qualify. New Canaan is it a bubble? It's not a bubble. It's just less population. So we have less people qualifying, but we still have people that definitely benefit from these programs. And so these are the numbers, New Canaan townwide. We do not have all of these residents. They have a right not to come to Human Services. You can deal directly with Department of Social Services and get everything done through them. So next, this is people served by the medical benefit plan. We have Husky. It is all based on federal poverty level, which is different for each state. Husky A is the health care for children and their parents or caregivers, guardians. Husky B is uninsured children under the age of 19, but they're in a higher income household. So the parents might not qualify, but the children do. Once again, it's a different federal poverty guideline to see where they qualify. And then Husky C, that is your Medicaid. It was formerly known as Medicaid. When someone says they're on Husky C, they're on Medicaid, and it's for the aged, the blind, and the disabled. Husky D, this is a population between 19 and 65 years old. So they don't qualify for the other Huskies. They don't receive Social Security yet or Medicare. And so it's Medicaid for low income adults that have not reached 65 or they're not disabled. So the eligibility is based on income and some asset assessments. And this shows you in New Canaan what we're looking at.
Anthony, this is again a very sizable increase over the period.
Once again, yes, because of the economic environment, more people are in need, as well as the guidelines have been softened because there is a need, more people require it. So it is a combination of the administration looking at federal poverty levels and assets and
But the trend line, Tom, was going up anyway.
yeah,
All COVID did was accelerated.
Yeah.
Not a
exactly.
plan for the long term.
Most of this is
Sorry, I had a question about, do these plans cover mental health with parity in terms of physical illness issues?
Some do. They're trying. There are definitely up at the state, up at Hartford, there's advocacy groups trying to get more mental health programs that are covered by these. What we do have, there are, if you go on to websites to see who takes Husky C mental health insurance, there are therapists that do. There are therapists that do. The best thing to do is to call the Husky provider, the number, and to see in your area, because you can go online. Psychology Today does have that in terms of what type of insurances they take. The provider, if they choose to be on the Psychology Today website or other behavioral health websites.
Hey, Bethany, Russ Barksdale, this is great data. Conclusions that you would draw from this data, and maybe I'm wrong, so I'm looking for your input on this. The conclusions on the Husky C, which would be your dual eligible Medicare, Medicaid residents, have remained relatively flat. So that's saying that our seniors who are retiring here have not, the increase from 2000, and I realize this is last updated in June 15th of last year, but the dual eligible seems to be relatively consistent for the Medicare, Medicaid, but the number of children has gone up, and my math's not so good, but has gone up almost 200% since 2012 for children who have now become Medicaid, which again, you would assume that decreases their accessibility to healthcare and to mental health services, things of that nature. Is that the right conclusion to draw from the numbers that you're presenting?
The increase, say that again, Russ, the increase you're looking at with children versus the sort of a flat line for Husky C?
Yeah,
versus
Husky C, as you were describing it, is really the elderly who are
Yes.
dual eligible, who are Medicare, Medicaid, so Medicare takes over predominantly. I mean, those are the people that we take care of at Waveney Life Care Network, and that seems to have been relatively flat. They are dual eligible, so on Medicare side, they still have the accessibility. They don't have the copay because the copay then falls upon Medicaid. But if you look at the Husky A, which is the children, they would have a difficulty accessing healthcare and mental health services and primary care positions being purely Medicaid, and that number's gone up, almost 200% over 2012. And maybe part of that is due to, affordable housing, but this seems to have a different feel to it, hence that they're going to have problems accessing primary care and mental health services as children. And to us, I think as a commission, not speaking alone, but that is a significant issue as far as I'm concerned, being a father of 5 and grandfather of 2. I worry about that access issue for them, going from 370 to now 806 children in our town.
So yes, with the affordable housing, more people with children want to come to New Canaan for a higher education. If they qualify for the affordable housing, and they have built more affordable housing, and they're continuing to build 40 more units at Canaan Parish that will be completely affordable housing. There are 60 units right now which are filled for the low income Section 8 tax credit housing. So what we see here, and also Husky A, they have broadened their guidelines to capture the children. Husky A, Husky B. Has there been a Husky B? They just started 44 up to 80. Yeah, definitely. So it is something, but there is access to healthcare based on in the area what is being offered. Community health centers, Norwalk, Stanford, Bridgeport area, people do use those for the health. Do we have pediatricians in town that take cases, offer it? I don't know what their current, maybe Harrison can tell if they do take Husky C.
Peter,
Yeah,
can you
we used to take it, all Medicaid, et cetera, and you can see somewhat from the numbers, there was a surprising number of patients with that. However, our adjoining communities, Norwalk primarily, but also Stanford, were not taking them. So we were getting inundated with Medicaid patients. So we had to close the door, unfortunately.
Yeah. So there are services and we do get them resources. It's very user-friendly, the process of finding healthcare for children. But yes, and that is why we have a very strong program, Human Services, that we do pay for other things to bridge gaps, to allow better healthcare, things like that.
Yeah, but Bethany, and maybe Peter can help us here, because I know there's community health services that are set up for Norwalk, and if New Canaan children are seeking care in community health services, I know that the town of New Canaan certainly and Human Services certainly are not signing off on subsidies to subsidize the difference between a Husky payment and what a normal bill would be. So Peter, can you help us out here a little bit? I mean, these seem very alarming, and I know you're really involved with community health services in the Norwalk areas. Is this migration over to those services for New Canaan children, is that what is occurring?
Rust, I don't have a feel for that. I mean, I can certainly dig in and see what's happening there, but don't have anything for you right now.
So we do encourage, the families to come in. Jackie is very networked in with the schools, so that, and the counselors, teachers, things like that. So we try to navigate and guide someone to Human Services, but there's free will and there is stigma out there, but we do try to get them, we try to be as user-friendly, inviting, non-judgmental as possible, to try to get the parent to come in for services, or Jackie gives services, resources to the counselors so that they can give them. However we can help these families, we try to.
Yeah, Bethany, but I mean, we don't employ physicians, right?
No, we're not advocating in terms, we are a resource center. Yeah. Russ,
Right.
you're
So you're referring these children, these families, to a provider who may, to Harrison's point, who may still be willing as a pediatrician to accept Husky and being a healthcare provider, I will tell you that Husky doesn't even cover your direct costs, forget your indirect costs. So I'm just interested in maybe, Peter, if you could help us out here. If Norwalk's community health centers are really picking up, 806 children from New Canaan. I know we're not, as a town, we're not providing a subsidy for that. That would be very interesting to me as both a commissioner and a father, to know that the numbers have gone up that much, and we don't have actual. And I understand the role as referring agency, but we don't have the providers to be able to care for them. That's concerning.
So and what we do, and that is something that Human Services, we're not going to get into the medical aspect of trying to set up getting medical care into New Canaan. It is there. We use the resources, we utilize the resources that are in the area. What we can do is, if someone comes in and they need dental work, which very rarely does that get paid for by Husky, basic, you get the dental cleaning, things like that. What we try to do is, New Canaan, we cannot start pay for medical costs. They become exorbitant and it leads them down a road, and then the client might need more and more and more. What we do is we try to offset the medical care. We pay the electric bill. We pay items that can the rent, things like that, that can offset their medical care. There's not one human services in the area that will start paying for medical care. It's a real wonky road to be going down. And it's the taxpayers' money, and you can't lead a person up to one level of medical care and say, I'm sorry, we can't pay for that anymore. But what we can do is we can compensate somewhere else with other bills. That's the best, how we have found it works out very well. But Husky C, I mean, they will pay for things. They will pay for the basics, and we do try to find, medical care. But is it in New Canaan? No. And we cannot call and ask for free services. That's not in captures human services scope as well. We cannot find free service. That's not what we do.
Yeah, I think you're reinforcing the point. I think
Yeah.
that what you're saying is that, and Peter, hopefully, because I know he's so enriched in this section of it, but you go for Federal Qualified Health Center, FQHCs, and you are in Norwalk, and not only are you seeing, I'm guessing, similar numbers for Norwalk, but now you have a very wealthy community who, because of, I'm not, wanting to politicize 830Gs or the development of affordable housing, you've seen a dramatic increase in children requiring those type of services. And to Harrison's point, if our pediatricians in our community have maximized the level of care that they can provide, that these children are waiting in line in a longer prolonged line to be able to access a pediatrician in a different community. Those are the types of things, for me, are high priority for our kids and our children and our school system that, as a health commission, I think we should be, involved in coming up with a solution.
So just to let you know, we, Human Services, people do not come in here asking for medical help. They are receiving it for themselves and their children. Are they frustrated with some of the insurance? Yes, we contact insurance companies, things like that. We can only advocate so far, but to understand what the bill was, what was involved. People are getting medical care. I don't want that to be misunderstood. Kids are not waiting in line. People are not calling saying, I can't get an appointment anywhere. They are. There are walk-in clinics as well. Just like New Canaan, I mean, we go outside of New Canaan. I go to a Norwalk Urgent Center, if I need something quickly, or Stanford. So it's there, and these kids are not suffering for lack of medical care. And I just want to make that clear. So maybe the focus isn't as detrimental, huge, and worrisome.
In the interest of time, I will work with Peter, but basically the state has a number of medical, psychological, and dental facilities that are free in Stamford, Norwalk, Bridgeport, and all the surrounding communities. And so maybe I'll work with Peter to put together kind of a picture as to what that might look like. Particularly, Russ, you bring up an interesting point, because it's going to only get worse if we don't address it. So. But I want to have Bethany finish, have enough time to finish her presentation.
Yeah. Okay.
I suggest we take this statistical stuff and look at it offline. I actually don't believe these numbers. I think they're suspicious. And I think we should get inside them to see how they're created, because
You can go online. I can send you the link to show you.
we don't have 800 children in New Canaan on Husky. I just find that hard to believe, but anyway.
Alyssa McKenzie, Commissioner, Husky A, I believe, is families, right? It's not just children, it's children and families.
Yeah,
Yeah, okay, just wanted to make that
Husky A
clarification.
and Husky B is uninsured children.
Right, and I think these are children that were, or families that were potentially already in the community, but they're now finally insured. They're children that and families that
Yeah.
wouldn't have been insured.
It is insured, yeah.
otherwise.
With Obamacare, things like that, people having to get insurance,
Yeah.
things like that. Yeah.
All right, that's okay, but we should know what the number is, that's all. Yeah.
Okay. So this is people served by assistance type, state numbers in terms of cash, food, and medical. Medical captures all medical, Husky, A through D. That's it. These are the Department of Social Services numbers. Okay, so our numbers, and I can send you this PowerPoint if everyone wants to look over the numbers more and to get the link. Okay, so our program participation, this is the number of residents that are receiving federal and state assistance, as well as those that are in our program that are clients. When they say they come here, they do a financial assessment.
Wow.
So the largest category is SNAP. We see that the largest category is SNAP. Many of these clients qualify for more than one. Actually, the largest is Husky Medicaid. I'm getting covered up here on my screen. Oh. So that showing all these, what we have to try to figure out, people don't have to give us all this information, but through financial assessments and things like that, the programs that are HS clients, this is a very rough number, but this is what we see coming in and what we can, with the information that is given and offered, that we can sort of evaluate who is getting assistance through the state and who is coming to us in conjunction. And there are those people, that prefer to keep it the privacy. With these state and federal programs, they don't need human services for the food pantry and the things that we offer. So human services programs, whenever we find a need, we see a need, someone offers us suggestions, things like that. This is what we have currently right now as our programs that totally funded by the town's general assistance for human services, Salvation Army, and the New Canaan Community Foundation. And through the New Canaan Community Foundation, there are donors like the New Canaan moms, things like that, that flow their money and their donations through New Canaan Community Foundation. So that's what I mean by New Canaan Community Foundation. And you can see that choices counseling, everyone can just sort of read, moving ahead for the sake of time. So the grant requests that were approved for this year, which I would love to see maybe greater numbers going towards, these are the agencies that we utilize the most in New Canaan. And we do want to grant them money for helping with our residents.
Bethany, did you see a comparable from 2012 to I guess June of 2021, the data you have? Do you see that same percentage increase in the food pantry?
No. Food pantry is interesting. It's very cyclical. Because of the tax credits, the children were getting, per child, $350 a month. That really, our food pantry numbers, and in the area too, have gone down. The last thing people want to do is go to a food pantry. So we have not seen a food pantry increase. It actually is more stable. People come and go, but it is really the last thing they want to do. So in terms of the outreach and education, I can't tell you the number of the networking that Marcy and Jackie, Enza and I do all the time. We have an unbelievable relationship with all of these plus others. We're just trying to give you the gist of what's involved. It is working together collaboratively, partnering, whatever we can do in order to benefit the resident. New ideas come in because new situations come in. And what we do is we work with whatever is needed in order to offer the client assistance. So there's a huge individual process going on here. Each of these entities, we have worked with one client at a time to get the help that's needed for the family or adult.
I
So
would just like to add also that the Human Services
Mm-hmm.
and the Health Department have helped ABC House New Canaan significantly as well.
yeah, we do their flu shots every year. They needed, when they need something, they call us. Yeah, Alicia, yeah, absolutely. We've worked with them for years and it's definitely wonderful.
Very helpful. COVID testing too,
Yeah.
and vaccines. So thank you from ABC House.
Absolutely. Love that. Love that house. So the mission statement, see it again, you can see the fluidity and the partnering, what happens when someone walks in that door of Human Services, walks in our door. We have no idea what the situation is or the phone call, but then we start. And from the human service level, the individual, the community level, it's all back and forth, around, up and down. And this is the ultimate goal of having a resident function optimally in our town. And the staff, I mean, Marcy and Jackie, they just literally, their hearts are right there helping. They take each person, one person at a time, and it takes time. And as I said before in other meetings, the situations have gotten deeper. They have gotten more involved, more of a tangled web in terms of, they've been in COVID for a couple of years. We have to do a little more untying the knots and seeing what's there in the core. So, whoops. Let me decline. Sorry about that.
That the meeting is.
Hold on, I'll call you back. Hi. Okay, grandson. All right, so that being said, everything, there's not one certain way to get help from Human Services. It comes from all different angles. We are here loving what we do. It's exciting, it's sad, it's happy, it's everything, a lot of emotions, but our goal is to help the needs of the residents, and we'll do it in any which way that someone comes in, but within the scope of Human Services. So that, let me stop sharing.
Very impressive. Thank you, Bethany.
Bethany,
Yeah.
yes.
Very
Okay.
Thank
impressive.
you for a very thorough presentation.
If I can send you, I can happy to send you the PowerPoint. You can look up the metrics. There are the links of where to find them.
Thank you.
Yeah, United Way also has great metrics. If you go on United Way, you can see towns and counties and things like that, what's happening.
Thank you. We do appreciate that we have a very exceptional staff working with us. For the sake of time, Marcy, do you want anything that's significant that you want to present?
I don't have anything pressing. No, I
Okay.
just a continuance of a steady stream of referrals from EMS and police, and working closely with protective services is what we've been busy with.
Yep.
Okay, just as the final act of the American Rescue Plan Act, Silver Hill Hospital, so they received $250,000 for their emergency acute diagnostic center, clinic, whatever it ends up being called. It's going to consist of an evaluation by a psychiatrist, by a APRN, advanced practice nurse practitioner, and by a social worker, roughly 3 to 4 hours. It's going to, the monies will be paid for by the ARPA funds to kickstart that and to cover any New Canaan residents who don't have the insurance or need the finances not covered for this. Our first selectman was talking to Darien, Wilton, Richfield to get them to go along with this, not only in terms of kicking in with some ARPA funding, but also possibly just enhancing the utilization so this does become a success based on more numbers and availability. So we'll see how that goes. And Waveney received $400,000 for their telemedicine program. And do you want to briefly discuss anything about that, Russ? Are we finished?
No, in the interest of time, thank you, Harrison. I know there was a program on Channel 12. Thank you to Bethany for our Jen for sending that out to everybody on telemedicine and how ambulances are now using telemedicine in Hartford to connect to hospitals. So thank you for that. And we will be, as soon as the funds are received, be reaching out to everybody. I know a lot of people have been calling, asking to get hooked up and connected. So thanks to everyone's support in that effort. And I thank you, Bethany. I think, you know, your full presentation, I know, at least for me, as brings up more questions than it does answers. And I think in terms of priorities, in terms of going for grant funding for the state and federal for some of these issues. And I think for children especially, I think there's some opportunities there for us. And though we're not large enough I believe, and Peter can correct me if I'm wrong, to be an FQHC, I think certainly these children need our assistance and help, and the families need financial assistance, even being the wealthy, affluent community that we are. So thank you for bringing that to our attention. I appreciate it.
Pleasure.
The last issue was the communication from Russ regarding the agenda, et cetera. I was going to kickstart that with just discussing some of the issues. I think for the sake of time, we will not do that. Could be lengthy. So we will I'll either do something online and send it out, or we will just address this at our next meeting. Okay. Thank you
I have
all.
a quick question regarding FOIA and communications outside of our designated meeting times. When I do have questions or we do want to have discussions, what are our limitations? Because I know that these meetings are recorded for a reason, for public information. And what communications are we allowed to have outside of these meetings?
You can email me with anything or call me and we can put it on the agenda and bring it up. I mean, there are a number of things.
But are there specific rules about members meeting outside of these meetings? I think there are specific rules about members meeting outside of this meeting. So I just had a question. I think we need to have more robust. Yeah.
If you email me or any town email, anything you say in that is FOIable.
Yeah.
The only time it's not FOIable is if with our town attorneys, attorney-client privilege. So just know anything you send via town email is FOIable. Any document that's sent out, unless it's watermarked draft because it's a working document, is FOIable. So, and if you're for personal people, if you're using personal emails and it's for work, that becomes FOIable. So just tread lightly.
Jen probably
pick up the phone and call.
Jen has been
well, no, I also like oral communications and meetings. I do think it would be helpful to have small group meetings, et cetera, between.
You just can't have a quorum.
Right, you can have committees. There are committees you can have, right, Jen?
Yeah, but you got to keep the number small. You can't have a quorum. Because if you end up with a quorum, then it's got to be publicly posted and everything else.
Yeah.
What's the number of members now? We're up to 9, right? So we can have up to 4 of us. Is that correct?
I have no idea.
I think it's also what your party registration is, right? Because 2 Democrats can speak offline, but if a Democrat and Republican want to speak about commission-related business, they need to notice it.
Amazing.
I don't know. I know Jen has been in the process for you, so I refer to Jen on that. I do know that if we're talking about agenda items and we communicate to everyone and to the chair, that's completely acceptable. I do think that when we talk about breaking up into committees, which is something that I know our chairman had recommended early on, I think that's something that we just have to be careful of. But I think if we communicate and circulate, here's an agenda item, I think we're covered. But again, not having an attorney on it as a commission, probably Jen has probably had been more FOIA requests than anyone, so I defer to her on that. But that's my understanding.
Yeah.
The town clerk probably has information on that from a commission perspective, or the attorney with the town code.
We should get an answer to Alicia's question though.
Yeah, I will do that. I'll speak to her and get it, and we'll address Russ's issues
Yeah,
also.
Claudia Weber would know.
Yep.
Thank
Okay,
you.
so again, thank you all for attending, and happy Mother's Day in advance,
Thank you.
and hope you have an enjoyable month, and we will see you next month. In
Happy
terms of,
motion to adjourn. Thank you.
yes,
Yes.
thank you. Second, all in favor, aye.
Bye.
All
Thank
right,
you.
everybody, I'm going to stop
Thank
recording.
you.
Thank you, and we'll see you next month.
All right, bye, everyone.
Bye.